Okay, so I just saw my oral surgeon for, I think this was like the fourth time I saw them. I had my stitches out about, I would say, a week ago. I had the stitches out, so no more stitches. There's now, again, a titanium screw inside of a bone implant in my jaw, and then there's a cap closing off that screw hole. And so it's 7 days after I got my stitches removed. About 2 or 3 days after the stitches were removed, I was actually able to, with my tongue, feel some sharp things coming out of my wound. And I was like, that's not supposed to be there. And I didn't eat any sand. It felt like sand because I've eaten sand before, because I swam at the ocean. If you swim at the ocean, you know, and you're good about it. You actually go in the ocean, you dive around, get ocean water in your mouth. You kind of know what sand feels like in your mouth. So I was like, I didn't eat anything with sand. And why am I crunching on sand now after removing some sharp stuff from the wound? And then over the next few days, I noticed more and more pieces of sharp stuff coming out. And when I looked at it, it was like maybe 1 millimeter or 2 millimeters of sharp shards of either porcelain or bone shards coming out. So actually tiny pieces of bone came out. And I wasn't aware that that was actually potentially part of the process. But when I saw the oral surgeon today, he said that's normal. The body sometimes finds pieces of the bone implant and feels that they don't belong there, and your natural immune system and cellular growth processes of your jaw will just slowly push those tiny shards of bone out through your gums. So I had little tiny teeth coming out of my gums, and you can't see them, they're not visible to the eye, but I can still feel them with the tip of my tongue, that there's like at least 1 or 2 still trying to come out, and they just slowly migrate out from where the implant was done out to the surface of the gums, and I just spit them out or I swallow them. So that's a weird part of this implant experience that I'm happy to share with you. I had no idea this happened before, but after I've since Googled it, found out that having little pieces of bone, or maybe even the drilled out part of the original tooth that was extracted originally in the process, or even pieces of the last crown, if there was pieces of crown in there when it was drilled out. Probably not pieces of the crown, it's probably just bone shards. That's probably what I'm dealing with, not really actually teeth that are actually coming out, those pieces, tiny pieces. But yeah, so that's part of the experience as well. I have about 3.5 more months before an actual tooth can go in there. What I mean is a crown, like a fake tooth that's going to be colored to match the rest of my teeth and angled and shaped accurately for cosmetic reasons, to go right into where that receiver is, that titanium receiver that's now implanted underneath my gums. Got about 3 or 4 months to wait for that procedure. Interestingly enough, after the implant, after the swelling came down from the initial surgery, the flipper that I had, which is the artificial denture tooth that I had temporarily, that I showed you guys on the last video, it no longer fit because it actually had a palate, a part that kind of suction vacuums to my palate, and my palate actually changed shape. It became more convex, where it was maybe more concave before. But after the implant, I guess in the implant, they actually inserted a screw, inserted some bone shards into a part of my jaw. The jaw actually changed shape, and the palate changed shape. Even with the initial swelling from the surgery down, the shape of the palate was such that my flipper, which relied on the shape of my palate, it matching the shape of my palate, it was made with an imprint, one of those kind of gummy imprint things that you do whenever you get braces or retainers, or the same thing had to happen. It no longer fit. So I actually brought it back to my denturist, and they figured out where the pressure points were. They used a type of spray that tasted like mint, and that kind of marked the locations of the pressure points on the denture as they put the denture in, and then they shaved those portions until there was no longer pressure points, so that the pressure between my palate and that flipper, the denture piece, was evened out. And then that allowed the denture to sit back in place. And so now I still have a denture. Let me see if I can put it in so you can see it. didn't bring it with me. I just go around without the tooth now. I've gotten used to it, so I don't have it. But yeah, I'll show you sometime how that flipper goes in. I did show, I think, once in a prior video of this this vlog series. So I think the next time I'll be vlogging about this particular experience is probably when I get the actual crown in with the screw and all that stuff. So yeah, I'll see you then. So I am post-op probably like 5-6 weeks since the oral surgery, when they did the extraction and the implantation of the titanium screw and the porcine bone all at the same time. Pretty pleased with how the experience has gone so far. Yeah. Any questions, comment below. Thanks.